Wonderful. So I'm, as you say, Professor Kevin Fenton. I'm the Public Health Director for London. I'm an infectious disease epidemiologist and an academic, as well as a person who delivers and designs public health programs here in the city, and I've had the privilege of working around the world. In my day-to-day job, I'm the statutory health advisor to the Mayor of London, Sadiq Khan. I also work with the NHS in London, and I also work with the Department of Health and Social Care. I'm really excited about today. It's amazing to have more than 2,000 people joining us to focus on quality and improvement. It's such an important part of what we do in public health and in healthcare, and in an environment where resources are tight, where it's becoming more challenging for us to deliver great services. Focusing on improvement and focusing on quality is going to be key. So I'm really pleased to be here today.
Oh, thank you, Kevin. And I agree tremendously with what you're saying. And I think people would love to know your secret. How have you been able to stay connected to communities? Because that is part of the quality improvement and really integrating communities into our health systems properly and authentically. So how have you been able to do that from your position as the Regional Director of Public Health?
Well, thank you. That's such a great question. And it's one of the things that I bring uniquely to my job as the Public Health Director for this city. Working with communities has always been part of my practice.
Yeah.
I started as a public health doctor in the 90s working on the HIV pandemic. And at that time, learning to listen to communities that were affected by HIV and learning to engage communities that were marginalized or who didn't have voices really shaped my early career. And over the years, I've been able to do research with communities, develop programs with communities, and especially during the COVID-19 pandemic, really brought communities in to be part of the response to the city. So for me, communities are essential for great quality, to improve our programs, and of course to have culturally competent programs and services, which in a diverse city such as London is exactly what we need.
Wow, you're tickling my senses, right? So just a bit about me. I'm in my day job, I'm a PCREF lead in North East London Foundation Trust. So culturally appropriate services is something that we really need across London. And I'm particularly interested about thinking, how does, I've heard you speak about racism as a social determinant of health and your insights around that. And just thinking, as we're developing culturally appropriate practice and implementing quality improvement methodology, how do you think systems should address this?
Yes, well, one of the things we've learned from the pandemic is that there is no tackling racial and ethnic health inequalities without addressing structural racism and discrimination. It is a fundamental part of our learning from the pandemic. And I know that across London and our health and care system, our systems are now committed to tackling those structural determinants of health in order to improve outcomes for all communities within the city. So in London, we have articulated a strategic approach to tackling racism and to being anti-racist in our health and care system. And that focuses on strong leadership, taking care of our staff, developing really effective programs to improve health inequalities, and of course to engage communities, to bring communities into the design and delivery of programs as well. And that pathway lends itself to improvement, it lends itself to improving quality, and it lends itself to doing things fundamentally different because we're centering our programs around the experiences of our communities. And I believe for a city, a global city such as London, that's exactly what we need to be doing at this time.
Yeah, and thank you for that. And definitely around the strategic framework, what you've actually given us is kind of like a bit of insight to someone who's on the ground. How can some of these frameworks and approaches apply to them? And I think it will be really interesting to get your thoughts, as you mentioned, about workforce and that being stretched. What advice can you give to someone who's really passionate about this agenda, who's a little bit overwhelmed by the system, but like to keep going, to keep pushing through and challenging the system and doing the good work?
Whether we are reflecting on our journey to improve quality, to improve our services, or a journey to integrate anti-racism and structural discrimination into our work as we improve quality, that work is never easy.
Yeah.
And I think there are a few things that I'm learning in my own practice, which is necessary for us to move forward.
Yeah.
So the first is to ensure that you have a strategic framework that guides your activity and prioritizes your action. Right?
Perfect,
Because we're all pulled in so many different directions. Agreeing with your partners, with your team, with your organization about where you want to focus is critically important. When you have that buy-in, is to focus on a few things and do them really well. Yeah? Oftentimes we get pushed into thinking we have to do everything and we have to solve these complex problems by next week. That's not how things work. We need time, we need to build coalitions, and we need to keep ourselves focused.
Yeah.
And the final thing is the journey is going to be long and often hard, and taking care of ourselves and taking care of each other as we do this work is also important as well. So taking time to rest, build our resilience, reflect on our practice, encourage others, and of course be ready to pass the baton on to the next generation as well, because this requires us all to be working together over time.
Wow, so many nuggets in there. Like I heard about embodiment, self-care, really thinking about oneself in this space, and I think this will really help others to think that sometimes when resources are stretched and funding's limited, just taking pockets and little bits of projects can really help.
Yeah, no, you're so right. You know, we have so many pressures, right? Especially if you're working in the NHS.
Yes.
Urgent care, emergency care, you know, restarting services and so forth. It can sometimes feel overwhelming.
Yeah.
And one of the things I say to everybody is define your space, do good work, evaluate what you're doing and improve what you're doing, celebrate successes, and bring others along with you.
I love that.
That's all we're asking from every one of us, and if each of us does that, we will make the change.
And thank you for that. You hit some key points about evaluation, which sometimes is easily missed in some of this work, because that also is another layer that takes time and needs a little bit of thought. Yeah.
You know, I'm an academic, so I always try to slip in evaluation wherever I can, because it's so important to understand not only that we're doing good work, but that good work is making the difference that we intended it to. And it's a key part of improvement as well.
It's true, because I hear a lot in my work about the evidence base, and when I say, oh, this is a great service, or this is and they say, okay, has it been evaluated? And sometimes it is a little bit difficult, but as you highlighted, it's really, really important. So, Dr. Kevin, I know that you are going to give a keynote today, and it's around community and health equity. So do you want to give us a little snippet about what you're going to talk about today?
Well, you know, I'm going to be doing the first keynote address this morning. It's a big gig to get started this morning. And so I'm going to be welcoming people to the city. You know, it's an amazing city of 9 million people. And within London, as you know, we all have different stories, right?
Yeah.
Where you grow up, where you work, your experience of London differs to others living in the city. And I want to highlight some of those differences that we have in the city, those differences which are driving inequalities. I'm going to be discussing some of the root causes of that, the causes of the causes, poverty, structural discrimination, poor access to care. I'm going to talk about some of the lessons we've learned from the pandemic as well, and how that is helping us to do things differently. And then finally, I have an amazing example which I'm going to share, which is about work that we've been doing with the HIV prevention community on improvement, just to show the art of the possible of applying improvement methodologies, not just in clinical care, but also in the work that we're doing in communities.
Well, I'm really looking forward to hear that address, and I think you've answered my next question, because I was going to ask you, okay, so beyond the data, what's happening? But I think you've really addressed that, and people can really start to think, because a lot of the time when we speak about addressing different problems in the system, people, their first stop is the data, but you've just clearly shown us that we can think slightly differently to develop change.
Yeah, I agree so much with what you just said. Data is necessary, but it's not sufficient, right?
Right, love it.
And we mustn't hide behind the fact that we don't have data, because we know for many of our communities, we haven't had the history, the research funding to generate the data. And so people can sometimes use data not to do things by saying that we don't have data. So in my practice, we have a principle of do and evaluate and improve. In other words, where data exists, use it, but where it doesn't exist, get started, evaluate, build the evidence base, and improve based on your evaluation and your work. And that's a more pragmatic and often a much more enjoyable way of doing what we need to do.
100%, I agree. So just for people out there who've never had the opportunity to come down to this conference, what would your advice be to them to come next year? We want more people to come next year and learn from international systems. So what would your advice be?
Well, I have to confess, this is the first time I'm attending this conference today. I cannot believe that there are 2,500 people who will be attending.
Yeah.
So I'm looking forward to today. So maybe speak to me afterwards and then I can tell you my opinion. But on a serious note, anything that can bring us together to reflect on our practice, to think about how we improve what we do, and to think about how we can serve the communities that we're called to serve better is a good thing. And the fact that you're bringing so many people from across the world who want to be part of this journey is phenomenal. So I'm really privileged to be here this morning. I'm looking forward to my opening address, but most importantly, I'm just looking forward to interacting and engaging with colleagues this morning too.